Westmoreland Community Connections is a presentation of the Westmoreland Drug and Alcohol Commission.
Welcome to Westmoreland Community Connections, a look at issues and happenings on Classic Hits 107.1 WHJB. Here now is your host, Chad Amond, President and CEO of the Westmoreland County Chamber of Commerce.
Hello and welcome to Westmoreland Community Connections. I'm your host, President of the Westmoreland County Chamber of Commerce, Chad Amond. We are delighted today to be hosting Mike Szwerc, who is a physician with thoracic surgeon at Excela Health, and Stephanie Scarlett, nursing coordinator of the Advanced Lung Center from Excela Health. Thanks for being on the show, Dr. Szwerc, and Stephanie. Thank you very much for being on the show. Tell me a little bit about your background. How did you get to get into the thoracic surgery division, and what's your background?
Well, thank you, Chad. Well, thank you very much for hosting us today. Lung cancer awareness is something that's really big in the state of Pennsylvania and Western Pennsylvania. I'm a thoracic surgeon by trade, and thoracic surgeons basically specialize in diseases of the chest cavity. So whether or not you need heart surgery, lung surgery, or surgery on your esophagus, people with my background take care of problems all related to the chest cavity. I went to medical school in St. Louis at a place called Washington University. And the interesting thing about Washington University is it did basically the first removal of the lung, entire removal of somebody's lung, and they lived for many years. And I got interested early on back in the 80s in diseases of the chest and trained in North Carolina at Chapel Hill and in Pittsburgh, and have done this for over 20 years now.
Stephanie, how did you get into this division at Excela, and what's your background?
I have been at Excela Health for about a year now. Prior to coming to Excela Health, I worked for Allegheny Health Network in both oncology and critical care. Both of those aspects have given me the experience needed to help people identify lung cancer early with the lung cancer screening.
I'm sure both of you see this all the time, and I would imagine that the listeners out there are thinking, well, you know what? With lung cancer, it probably has a lot to do with smoking. And since we are at the beginning of the year, this is probably one of those times where people say, okay, this is my New Year's resolution. I'm going to quit smoking. I'm going to lose weight. I'm going to start exercising, all of those things. Why is tobacco use so bad for the lungs, and why should people make sure that they stop?
Well, I think that's a important question to understand. What our focus right now is, in healthcare, we're trying to extend not only people's lives, but the quality of their life. And we certainly know that tobacco and related products shorten persons' life expectancy and probably decrease the quality of their life. Not to mention the expense. If you spend $8 a day on a package of cigarettes and you smoke a pack a day, you're spending almost $4,000 a year in just tobacco-related products. That's a lot of money.
Right.
That's a tremendous amount of money. But the important thing is lung cancer detection and lung cancer screening is really about trying to give people the opportunity for cure. In the United States, 220,000 people get lung cancer each year, and unfortunately, 160,000 people die from lung cancer a year. Now, other diseases, other cancers that get a lot of publicity, breast cancer, colon cancer, prostate cancer, if you take those three diagnoses together and add them up, they equal roughly half the number of people who die each year from lung cancer. And the important thing that we're trying to get the message out is that if you find lung cancer early, we can cure it. And that's why we have a screening program. And that's why we've put this initiative out over the last couple of years in Westmoreland County and other counties nearby to identify people that meet certain criteria that we could potentially impact their life in a very, very positive way.
Well, I'm 43 years old, and it seems like whenever I was a kid, in high school and college, there were a lot more people smoking than it seems like today. I don't know if that's the case. It just seems like that's the case. And you talked about cigarettes, but I go to a lot of golf outings and I see, guys smoking cigars and now this vape thing that is gaining a lot of momentum. Is it really just the cigarettes, the e-cigarettes? What is the impact of cigars and chewing tobacco and vaping? Is that impacting it as well?
I tell patients, they ask this question all the time. Well, what about e-cigarettes? What about vaping? Have you ever pulled up next to a stoplight and someone's vaping next to you and you see this big cloud of smoke coming out of there?
Yeah.
Picture this. Most of us have changed car filters in our life or air conditioning filters in our house. And you pull those filters out and you see how dirty they are and how filthy they are. And can you imagine your lungs? They're the most sophisticated filter in the world. Imagine repetitive smoke going in there 30 to 60 times a day. And imagine the impact. I've seen lots of patients in their 20s who smoke a lot of marijuana. And I've looked at those lungs many times in my career, and sometimes they're black. They are absolutely black. So the issue is all forms of tobacco, whether it's cigars, whether it's chewing tobacco, whether it's cigarettes, whether it's vaping, whether it's e-cigarettes, have toxic effects. They're all associated with a higher risk of different types of cancers, most notably lung cancer, but oropharyngeal cancers and others. And there's no question that cessation of all tobacco products is vital in terms of disease prevention, disease management, and extending quality of life. And notwithstanding saving money.
Well, you said that there was 260,000 people that are diagnosed with lung cancer each year. In southwestern Pennsylvania, is that number higher than the rest of the country, or is this something that is pretty much standard in every region around the country?
So they look at that question and they say, out of 100,000 population, what is the likelihood of any state developing lung cancer? So the states that are really high are Kentucky, West Virginia, Arkansas, Pennsylvania. States that are very low, Colorado, and some of the western states. So there's no question that we're above the national average in developing cancers, all cancers, and especially lung cancer. So in the state of Pennsylvania, roughly 10,000 people develop lung cancer a year. And there's maybe 77,000 cases of new cancer in Pennsylvania, 10,000 lung cancer.
Is that also a cause? Is that caused by the fact that we also have an aging population here? Westmoreland County, almost a third of our population by 2020 is going to be 65 years of age or older. So I would imagine, as not only the impact of the cigarettes and the vaping and all of that stuff, but is age playing a role in this crisis?
We target for lung cancer screening, our age criteria is ages 55 to 77. And per the CMS guidelines, that is the ages that patients are at greatest risk of developing lung cancer.
Yeah, so the two variables that lead to cancer across the spectrum are age and tobacco consumption, and the amount of tobacco consumption. And also what we know now, which we didn't know 15 years ago, is that there are certain links to genetics. If your dad developed lung cancer, if your brother has lung cancer, and you smoke, you got to be very, very, very careful, because there are things at play that we don't understand. We know that there's a toxic effect of tobacco and other things, but there's a genetic predisposition in certain families. We see this all the time. We see someone that shows up in their 50s, maybe a woman. She has lung cancer, and she'll tell us, well, my dad had lung cancer. Those are the people that really, really, really take this message and take it carefully, because if you find lung cancer in your family and you still smoke, your rates of developing cancer are tremendously higher than the background of smokers.
You're listening to Westmoreland Community Connections on Classic Hits 107.1 WHJB. We're talking with local clinical experts, from Excela Health, Dr. Michael Szwerc and Stephanie Scarlett, the nursing coordinator of the Advanced Lung Center. Talk a little bit about the Advanced Lung Center at Excela Health. What is it going to provide to our community? Excela. I was just at the new. We were at the ribbon cutting for the new Excela Square at Latrobe, and it's a beautiful building. And you have the Norwin Square, you have Frick Hospital, you have Westmoreland Hospital, Latrobe, in Ligonier. I mean, it's all over the county, and you're obviously impacting all of Westmoreland County with healthcare programs to provide. But talk a little bit more about what the Advanced Lung Center at Excela provides.
So any patient that's ages 55 to 77, you have a smoking history, you currently smoke or you quit within the last 15 years, insurance covers for lung cancer screening every year. So any patient that enters through lung cancer screening, they come in, they meet with myself as well as our nurse practitioner. We just talk a little bit about lung cancer screening as well as provide tobacco cessation education. And within a 30-minute time frame, they also get a low-dose CAT scan of their chest. There's no IV, there's no dye. The CAT scan takes about 5 minutes to complete. They go home and we call all patients with their results. Most patients are contacted within 24 hours with those results.
Well, that probably gives them relief in some cases, and they probably want to know that as quick as possible. I know that in the past there's been those things where you get the results 2 weeks later in the mail on a card. So you get if I were to go to the Advanced Lung Center at Excela and I had the test, I'm gonna get the results within 24 hours.
Absolutely. And in the event that we needed to do any further testing, we have a team of physicians, lung doctors, thoracic doctors, that are able to assist in any other testing or care. And as the coordinator, I also assist the patients with that process.
You know, one of the things that's scary, if we've ever taken a test in our life, and in high school and elementary school and college or beyond, you worry about the results. Did I pass that test? I can remember walking to the building, taking chemistry in college, and seeing my name up on a board, wondering what I just did, and the fear of walking to that building. Now, when we began this program, we said, we're going to do this differently. We're going to provide personal service, personal communication. People are scared. Everybody's scared of cancer. I have a skin lesion on my arm right now. I'm showing my wife saying, is this a melanoma? I'm scared, and I'm a physician. I understand it. So what we're going to do is do it better. And we say, you come in, get this CAT scan, and in most cases, Stephanie's calling you later the day and telling you things are great. And if there's something we need to follow up on, we'll follow up that week. And you'll meet me and you'll meet the rest of our team, and we'll come up with a treatment plan. It doesn't matter who you are. You could be from Indiana County, Fayette County, Westmoreland County. We'll treat you like one of our family, and we'll get you in and get this thing solved as fast as we can. What's not acceptable in my mind is a lot of places you get a report in the mail 3 weeks later. You got to sit there for 3 weeks waiting to see what the heck that scan said, and nobody calls you.
Right.
You got to read some piece of paper that you can't even understand. That's ridiculous, and I think we did it better. We've screened over 2,000 people now in the past 2 years, and each month the number of people coming is going up tremendously. The one thing that I would encourage your listeners to do is talk to their primary care physician.
Right.
Get a sense of lung cancer screening. Women get mammograms. Men get prostate exams. We all get colonoscopies. Now, this is an opportunity to find one of the biggest killers in our society, find it early and treat it early. That's the goal.
Dr. Szwerc, when you said that you should talk with your primary care physician about the lung cancer screening, what would a patient or someone in the general public know? Why would they know that they need to get that lung cancer screening? Or should everybody get that? Or is it something that if you smoke or if you have a family history of it, is that
so strict criteria?
Okay.
And these are governmental criteria. So you have to be between the ages of 55 and 77 to qualify. So if you're 50 years old and you smoke, you can't get a screen. Now, we're also looking for people that have no lung symptoms. They can't be coughing up blood. They can't have chest pain. They can't have other things. They basically have to be asymptomatic. A lot of patients at that age group are a little bit short of breath when they walk around. That's okay. And so you also have to have smoked a certain amount, and we define it as a pack year. So if you smoke a pack a day for a whole year, that's 1 pack year equivalent. So we need someone that has either smoked 30 pack years, one pack of cigarettes a day for 30 years, or 2 packs a day for 15 years. And what we are looking for is people that are active smokers or people that have quit within the past 15 years. So if you quit 20 years ago, by criteria, you will not be eligible. These aren't Excela's criteria. These are national criteria. Whether you go to any system in the country, they're going to use the same criteria. These are the criteria that the government, CMS, set as guidelines for this. Now, the other thing about lung cancer screening, 15 to 16 major societies, from thoracic surgery societies to lung societies to cardiovascular societies to nursing societies, all support the importance of this program. Why? Because the only thing that can cure people with lung cancer is early detection. Early detection. And if you say, well, what's the probability of early detection? Right now, it's probably about 16%. Most people, when they get diagnosed with lung cancer, it's at an advanced stage. They start coughing up blood. They go to their PCP, gets a chest x-ray, and he says, oh my God, you got a problem. We want to find people before that day ever occurs. So we need people to walk in. And the important point of our study is, if you come in now with no symptoms, and we find something small, and there's probably a 1.5% to 2% chance we'll find something. We'll find something at an early stage. And those are the people that we can cure. So this is the deal. Okay, I did smoke. It's okay. We're not judging anybody. We're going to help you with smoking cessation when you come in the door. And if we find something, we're going to execute a good plan to treat it.
We're talking with 2 people that are having a great impact on our community from Excela Health, Dr. Mike Szwerc and Stephanie Scarlett from the Advanced Lung Center at Excela Health. We'll be right back after these messages.
This is Westmoreland Community Connections on Classic Hits 107.1 WHJB. If you have a suggestion for a topic, or if your nonprofit organization would like to be featured on this program, call us during regular business hours at 724-216-1200.
Westmoreland Community Connections is a presentation of the Westmoreland Drug and Alcohol Commission.
Welcome back. You're listening to Westmoreland Community Connections on Classic Hits 107.1 WHJB. I'm your host, President of the Westmoreland County Chamber of Commerce, Chad Amond, and we are delighted to have Dr. Mike Szwerc and Stephanie Scarlett. They are with the Advanced Lung Center from Excela Health. Before we went to break, we were talking about some of the risks, and let's talk about some of the solutions. What are the tests that are covered, and are these things covered by insurance? I mean, obviously in today's environment, that's something that it matters, you know, with the high deductibles and all of those things. Sometimes people wait too long, right? So what are the tests and what are they covering? Stephanie?
So every patient that comes through the Advanced Lung Center for Lung Cancer Screening gets a low-dose CAT scan of their chest, and that is covered 100% by insurance as a preventative screening. Just as it covers mammograms, colonoscopies, insurance covers this screening as well.
Okay. And so what are the treatments for lung cancer?
Well, I think let's go back and understand. 220 people develop lung cancer. 220,000 people develop lung cancer in the United States each year, and many more million worldwide. Unfortunately, most people present when they have symptoms. And what are the symptoms of lung cancer? Well, cough, an unexplained cough that seems to get worse, or God forbid you start coughing up a little blood. If you cough up blood, go to your primary care physician right away and say, I'm coughing up blood. Weight loss, chest pain, hoarseness of the voice, shortness of breath, any one of those. What we're trying to do is find people before they have those symptoms. And we know all comers before screening, maybe the chance of you showing up with a small spot on the lung that you didn't know about was probably 16%. We're trying to make that number go above 50%. And so when we find a small tumor of the lung, the best option still today in 2018 is to remove it. And fortunately, we have new techniques that we've been using for the past 15 or 20 years, and these have even evolved in the past couple of years to where we do minimally invasive robotic surgery on many of these patients. And I'll give you an example. If you have lung cancer surgery, which is major surgery, and we do it robotically, there's probably a 1 in 3 shot that you'll just spend one night in the hospital and go home the next day.
Wow.
And when we do that surgery, I tell people, you can go home, you can drive, you can do whatever you want, you can get back to your living as quickly as possible. My mother had that surgery. She spent 2 days in the hospital, and she never took any pain medicine. And she was 75 years old. So not only are we trying to find tumors early, we've also changed how we take care of patients. And we have great technology, techniques to offer surgery to people as they get older, and really to try to maintain their quality of life going through the whole journey.
So what is the survival rate if you're diagnosed with lung cancer, heaven forbid? What is the survival rate?
Well, the survival is a function of when did you find it. So if you find a tumor that's, let's say, an inch in size, because we measure tumors by size. We use centimeters, but let's say it was an inch, and it didn't spread to any other spot, your chance of beating that is pretty good.
Good.
On the other hand, if you find a big tumor that's already spread to your liver or other parts of your body, the chance of curing that becomes extremely small. So we know the smaller it is, the higher the survival. So if something's the size of a pea, and it's much better than if it's the size of a golf ball. And so we want to find this, and that's our screening program. And the other thing that your listeners should understand is that when we get CAT scans on patients that are, let's say, 60 years old and have smoked, there will be some findings on that scan that might be abnormal. And what we have is a way to really counsel patients and their providers as to what's important and what isn't. We'll find a small spot, but we have a whole team of people that look at every CAT scan and make recommendations, saying, you know what, this doesn't really look like anything concerning. We're going to watch it a little carefully. It doesn't mean that you're going to get a biopsy. It doesn't mean that you're going to have surgery. We follow many things to try to really establish that they're tumors or not. And we really are cognizant of the fact that unnecessary testing is a problem, and we really counsel people as to what we're following. We'll invite everybody to come in and look at their scans with us and say, let me show you what we're looking at, rather than just get you something in the mail that says come back in 6 months or come back in a year. We'll show you. Anyone that wants to see their scan, I will personally show it to them.
So obviously, early diagnosis is a critical factor. So how does we're blessed to live in southwestern Pennsylvania with all of the great healthcare providers, and Excela is one of the best. I mean, the quality of diagnosis and care at Excela is sometimes overlooked, I think, by the locals. And so how does Excela measure up across the country with finding cancer sooner? Are you in the middle of the bell curve, or where are you?
Well, I think a lot of patients have a perception that, my God, you get cancer and you have to go to the Mayo Clinic, or you have to go to Memorial Sloan Kettering in New York. And the reality is what you have to do is find a good team of providers to take care of you. And if you can find that team locally, I think you win. Because what we do after surgery, if we do lung cancer surgery on you, we'll invite you to come back to our office and see our team every day. If you go to New York to have your surgery, or you go to a bigger city, and it's a couple hours away and parking is a problem, it's very hard to get back to see your provider. And a lot of times you won't see your provider again. You'll see an extender, or you'll see an intern or a student. Our team takes care of you personally, and we'll bring you in as a family. We'll take care of you, and we'll take care of you for the whole duration of your cancer care. And your duration doesn't end with the surgery. We'll follow you as patients for life. And so in my mind, providing quick, efficient diagnoses, executing a good procedure, and taking care of the recovery is about as good as it can come. And if you can get that closer to home, then I think ultimately you do better. A lot of people are older, they don't want to drive to cities. It's not safe to drive to cities anymore. Just getting on 30 is a dangerous thing.
Right.
My wife's already had a car accident out there. And so, I really think people can get exceptional care locally. And that's just not me talking because I happen to run the program. All our data is benchmarked against national data. So we know that when you have cancer surgery at Excela, what's the chance of dying after the surgery? What's the chance of having complications, infections? What's the chance of coming back and getting readmitted? And we have our data benchmarked against the best of the best, and I think we're very proud of our program.
You're listening to Westmoreland Community Connections on Classic Hits 107.1 WHJB. We're talking with Dr. Mike Szwerc and Stephanie Scarlett from the Excela Health Advanced Lung Care Center. And one of the things that you brought up earlier, Dr. Szwerc, is that lung cancer has actually impacted your own family. With your mother, and understanding that on the clinical side, how do people react on the family side? I mean, what can they do to make this process, this diagnosis, something that they can deal with from day to day?
I think that Excela Health has an amazing team to help patients through this process. My mother-in-law was recently diagnosed with lung cancer, and from the time she entered into Excela's hospital, from every individual that has entered into her care, from the nurses, the lung doctors, the thoracic surgeons, as well as the oncologist, every individual has touched her personally and given her hope to fight this battle.
So, Stephanie and Mike, both, you have also been on the front lines with this as a diagnosis in family. I would imagine that gives you some increased passion about the people that you serve every day. Is this something, is lung cancer more prevalent with men or with women, or is it just pretty much a coin flip?
Well, if you look at the data of 220,000 people who get lung cancer, the incidence rates in men are a little higher than women, but they parallel the smoking trends in our society. So when women started smoking more, their incidence increased. Importantly, though, Chad, what we're seeing now is we're seeing a lot of people that also never smoked, especially women that are in their fifth decade of life, and they present with tumors. And it's sort of like, why? And that's where the genetic component of lung cancer is important. And that's the message, again, to your audience, is that if you have a family member who developed lung cancer, really, 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 you cannot smoke. You should not smoke. And if you have symptoms, talk to your primary care physicians. For my mom, who developed lung cancer several years ago, she lives in New Jersey, she had a routine CAT scan for another reason, and they saw a spot on her. And had she not had that CAT scan, God only knows what her situation would have been a couple years later. And that's the whole purpose of lung cancer screening, is to find these small spots before they ever become a problem. And people talk about, well, how laborious is this journey? For Excela, we are going to open up our third screening site at Frick in hopefully the next month. We screen now at Mountain View. And the process, and Stephanie can talk about it, is really about a 20-minute process. You come in, you park over at Mountain View, there's ample parking, you come walk right in, you don't have to go through corridors and buildings to find the place. The CAT scans are there, Stephanie's there, our team is there, and you can come in and out in 20 minutes. Or you can go down to Norwin and do the exact same thing. Mm-hmm. And so I think we've set up a program that is so user-friendly that we want to make it easy for people to come in. A lot of people come in and they don't know if they're going to have a copay. We'll talk about that. We'll talk about the insurance issues. And you can call any time and just say, do I qualify? Or even if you're worried about your mother or your father, just call in and ask us, and we'll tell you the criteria. We're happy to say you're not eligible. We'll help you in any way possible. And you're not going to talk to a computer. You're not going to talk to some foreign country. You're going to talk to people that are going to answer the question directly. And what's that number they need to call?
It's 1-844-2-TEST-ME.
Right.
So 1-844-2-TEST-ME is the way that a listener, or maybe if you're listening and you have a family member that is struggling with, what are some of the symptoms? The breathing, you said, obviously coughing up blood, that seems like one of those things. But if you've been a smoker for all of your life and you hit the age of 55, is that one that you would suggest that those folks come in and make sure that they get tested, correct? And one of the other things, I was glad you brought it up, because I've I've heard the perception before that, lung cancer is sometimes a self-inflicted wound, because if you've been smoking all your life, hey, you probably have caused a portion of this. But you brought up that you see a lot of patients that are not smokers. But for the ones that are, right. How does Excela have a smoking cessation program or a referral that you can advise the listeners to?
Every patient that is a part of our program, we do provide smoking cessation in the office, and as well as anybody can call and ask for assistance with that. We have a tobacco cessation coordinator that also is able to work with the patients and check with insurances and identify any resources available within the community. We also can write prescriptions for patches, gum, lozenges to assist with those, and we are always available to provide support through that process.
Well, we're running out of time, but I want to thank you on behalf of Westmoreland County and our community for the work you're doing to make this county a healthier place. We've been talking with Dr. Michael Szwerc and Stephanie Scarlett with the Advanced Lung Center at Excela Health. If you want to be more engaged, I would encourage you to call 1-844-2-TEST-ME or jump online at excelahealth.org and search lung or lung care, and you can make sure that you connect with Dr. Szwerc and Stephanie Scarlett. So you've been listening to Westmoreland Community Connections on Classic Hits 107.1 WHJB. Join us next week, same time, same place, for another edition of Westmoreland Community Connections. Thanks for listening, everyone.
This has been Westmoreland Community Connections, a look at issues and happenings in and around Westmoreland County. Join us again next week on Classic Hits 107.1 WHJB.
Westmoreland Community Connections is a presentation of the Westmoreland Drug and Alcohol Commission.